I'm Patricia Vallone with CTV News. The CDC recently began recommending that people wear cloth face masks when going out in public places, such as pharmacies or grocery stores. Now, as we've learned about COVID-19, it can be transferred in close proximity through sneezing, through coughing, and even through speaking. I took a trip to a park recently and found out that a lot of people are heeding the advice.
Me and my family, we decided to wear face masks just yesterday because there's a public announcement by the president and the CDC to wear masks as much as possible. It should be the cloth mask, but we have like this one right before this happened. So I think it's better to have this because they declared also that it's airborne instead of droplets. So I think it'll be a good decision to wear masks while staying outside and walking around.
Tell me why you decided to start using a face mask.
Because I heard it's a good idea to have it. So hopefully if you're asymptomatic, you don't give it to somebody, and if somebody has it, you won't get it from them. So hopefully it's a double protection.
Does it make you feel more comfortable being in public with it on now?
Oh, now I do. I mean, I feel a little bit silly, but I do.
I started wearing it a couple weeks ago. I would read that not to wear it, but I was like, how can it hurt? So I figured I'd rather be safe than sorry. So I don't wear it religiously, but when I know I'm going to be out around people, I tend to put it on. And yeah, it's just something I try to think to do.
Is it a little easier now that the CDC is recommending it?
I maybe subconsciously, but really I don't even care what other people think. I was like, you know, whatever I think can help, I'm going to do.
Tell me why you've decided to use face masks.
Well, to protect others and also to protect ourselves.
And also, I've got allergies this time of year. This is the worst time of year and probably the worst allergy season I've witnessed in a long time.
How long have you been wearing them?
A couple of weeks.
Yes.
A couple of weeks? So
yes.
You did this before the CDC recommendation?
Yes, we did.
And I actually used to work at a computer warehouse about 5 years ago where this was actually before it was in style.
So how is the response from the public when they see you with the face masks on now versus before?
It's a lot more. I think it's a lot more accepted now. Earlier on, people were looking at me,
and I thought I needed a shirt that said, "I don't have the virus. It's just called allergies." Yeah.
Because of the new CDC regulations and what Dr. Fauci has said as well, and because we thought when we came out to Brookside that there might be more people today since the tulips are out. And we just wanted to ensure our safety and the safety of others.
Is this the first time you've been wearing a mask?
Yes, it is, actually.
How is it compared to, if there are people who have been wearing them for weeks who said they were kind of harassed and given a death stare when they were doing it? Do you think it's more comfortable now?
I definitely think it's more comfortable now and more accepted, but I just didn't feel it was necessary previously.
And you do now? I
do, yes.
I am visiting my mom because I haven't seen her in over a month. I thought I'd bring her flowers, but just as a precaution, I decided to wear a mask because I would hate to get her sick, even though I'm not really feeling sick. I just, as a precaution.
So is this because of the new CDC recommendations, or were you doing it before?
No, it's more because the death tolls are going up, and it just gives me more anxiety. So I started wearing a mask.
As a precaution?
Yeah, as a precaution, yeah.
Your whole family's decided to use face masks. Tell me why.
Well, it's being advised. Early on we didn't think it was necessary because that's what the health experts were saying, and now more and more they're saying even if we don't think other people around us have it, that if there's any possibility that we have the virus, we don't want to spread it to other people.
And how about you guys? You're the youngest I've seen here in the park that have decided to wear it. Is it strange, or are you feeling comfortable?
Sometimes this comes off, but then I just slip it back on. But yeah, it makes me remember to stay away from other people, because it's right here in my face, and I remember not to get too close to anybody.
Okay, and Dad?
I think there was a mental barrier that about wearing masks that was tough to get over. Once the switch happened where I realized, wait a second, I'm not really protecting myself from others as much as I'm making sure that if I haven't and don't know it, I'm protecting other people from that droplet of a sneeze or a cough that might happen. Once I figured that out or embraced that, it's a little easier to wear the mask.
So you've got a face mask on. Tell us why you're doing it today.
I do. I'm really concerned about the way that the disease is slowly spreading and the fact that it might be airborne now. I mean, I've been following the recommendations as much as I can, with the distancing and staying away from people. And I'm lucky my son-in-law happened to have one of these work type ones in his car, and I was given it. I'd have the scarf on otherwise. But I'm concerned about the airborne quality of stuff going on. I really am. And occasionally I run into people that don't keep the safe distancing. It's also a visual reminder saying, yes, something is going on. It's both visual and also, I think, factual. Yes, there's something going on. It's airborne, and this will protect us. I was a little concerned before when they mentioned how well people really shouldn't be wearing them. But again, since they're discovering how much more airborne it seems to be, it seems like a smart thing to do. I don't have access to the test per se, like perhaps the president who's been tested multiple times. So I really don't know what's going on that way. Also, we're not on our plan A as far as the epidemic is going, pandemic, excuse me. We've been trying to get back on track, but things aren't happening. I remember seeing how they wanted to start drive-through testing in places like Target and CVS parking lots when they had the presidents and CEOs of those companies on the president's daily reports, but that hasn't happened yet. So we really seem to be on track in lots of different types of preventive matters. And again, the distancing and whatever else we can do as individuals seem to be where the strength of containing this is. So that's another reason I'm wearing it. And again, also to remind people that may not want to social distance that yes, something serious is going on. So I'm concerned. I'm concerned about our country being on Plan B. I'm concerned about all the other stuff. But there are things we can do. And again, this is both a visible and a symbolic thing of yes, there is a pandemic on.
Now, officials are asking that you save these critical N95 face masks for medical and emergency personnel. They say you can go online to buy a cloth face mask at either Amazon or Etsy, or you can learn to make one yourself. You can just Google do-it-yourself cloth face mask. From Silver Spring, I'm Patricia Vallone, CTV News.